Hi, everyone. Welcome. We are so excited to have you guys here to learn about the aging face, something that I'm sure many of us are super excited to learn, including myself. And I'm super excited to have none other than the lovely and talented Jennifer Jordan, PA, from our Pflugerville and Steiner Ranch locations with us today.
Hey Taylor, how's it going?
It is going so well. I'm so excited to be here with you. And word on the street is you have been with the Sonova Dermatology family for almost 10 years.
Yes,
It's
yes, I
so
know.
ex-
Isn't that crazy?
it is so
Yeah,
crazy, but so exciting. It's been a wild ride, I'm sure. And it just keeps getting better, huh?
yeah. No, it's a good gig. Yeah, no, patients will come in and they're trying to make up their decision about what they're going to do and when they're going to do it. And I'm like, I've been here almost 10 years. I'm not going anywhere. So,
Love it. Love to
I'll be
hear
here
it.
when you come back. Yep.
Awesome. So let's just kick this off. Let me get the presentation started. Technical
Okay.
difficulties per usual. So let's see here. I've got her roaring up, and there she
There we
is.
go.
So we're talking ageless and glowing, which we all hope to be. And the
Yes, I
myriad of
love that.
things. Yeah, I do too. I think glowing is the key. I want to look
Uh-huh.
glowing.
Uh-huh. I like to say sparkly. I like to look a little sparkly.
And there you are. Speaking of sparkly, love it. So we talked about this. We're going to talk a little bit about facial aging and volume loss specifically. So on that note, tell us a little bit more about the aging face.
Right. So I really love this kind of split face screen here. It shows a mother and a daughter, and you can see if they're essentially twins of each other. And when you look at this split face screen, it makes it really obvious, the various changes that we see with time and with age. And I'll hear this a lot from patients of, I have my mom's this or I have my dad's this, and I want to prevent and correct. And so they will point and comment to things about, noticing that they're losing volume under the eye, they're losing volume, around the mouth, they're getting browns, they're getting, changes in texture of the skin. But this is a great split face that really helps to make it super obvious the differences between a youthful face and then obviously, aging face. Yeah. So again, these are obvious, but just to kind of reiterate, typical youthful features, obvious, our skin is smoother when we're younger. We don't have these deep lines, we don't have these deep folds. Our skin color is even. We haven't had a lot of sun damage. We haven't had a chance to get a lot of freckling. Um, Cheekbones are nice and high. Cheeks are full. Our fat pads are nice and in place. They haven't had a chance to shift and shrink. Our jawline is defined. Again, back to the thick fat pads. And then we've got great bone structure. As we lose bone mass and other areas of our body, we sadly also lose it in our face. I don't know if you knew that little not so fun fact, Taylor, but when you lose bone mass elsewhere in your body, you also lose it in your face. And that contributes to the appearance of the aging process.
I did not know that. That's crazy.
I know.
I feel like I am deflating myself. So I'm all ears. Tell me what I can do.
So again, the aging features, you get those grooved in lines from facial expression, facial movement. I feel like, if it weren't for, neuromodulators, Botox, and Dysport, you would see some lines from talking to my 12 and my 14-year-old. But you get those set in lines from facial movement. You get sun spots, and with sun, sun exposure, just life history of sun, you're getting brown spots. You're also getting broken blood vessels. Going back again to the age-related changes that happen, some people will comment that they notice this deep fold that gets here, but a lot of it, sorry, Taylor, yes, sir.
No, that's me. I'm the one.
Oh, okay. Okay. I thought you wanted to ask me a question. Sorry about that. Okay. So you'll get these kind of deep lines here. But these deep lines, it's really related to volume loss and changing that's happening kind of higher up. You'll notice that your cheek gets flat here and it also gets flat here. Sagging jawline, again, these are all normal things that happen. Double chin that happens, fullness in the lower face, normal aging things that happen, and thank the Lord that there's things that we can do about it.
For sure. So we're going to kind of take it the next level here, and we're going to reiterate some stuff, but tell us a little bit more about muscles.
So two ways you kind of want to think about, right? Different ways that you can treat this aging process. So there is changes that happen at the level of the muscles. Remember, like I talked about, like the furrowing that happens as, I'm grimacing at my 12 and my 14-year-old, or even, all the time that you spend outdoors, squinting, making those smile lines, which, I love a happy animated face, but it does contribute to the lines that we see kind of down our cheek. And then two, kind of scrunching up around the nose. These are the lines that you get from, dynamic facial expression. And so these are the lines and the signs of aging that we see from the motion of the muscles. And then this is back to kind of that fat pad comment that I was referencing to. There are deep and superficial fat pads, and over time, they will shift, and sadly, they will shrink. Seems like we get fat in other places, but here they shrink and they shift. And so this contributes to kind of the hollowing under the eye, as well as that loss of fullness in the mid cheek. And you'll start to notice that you're getting wrinkles and lines around the nose and the mouth. You're getting kind of that jowly appearance because everything goes south. And you'll get the fullness under the chin again because you're, getting deposition, in different areas that you don't want. I love this diagram because they show on the youthful, the young daughter, her fat plaids are nice and in place, and then and the mom, they have kind of shifted and shrunk.
Yeah, something to look forward to.
I know it's a terrible thing.
So now that we've talked about, go ahead.
Oh no, yeah, just how it goes.
I was going to say, now that we've talked about all of these wonderful things that we're looking forward to, we have things that we can do about it, which I'm super pumped to hear about. So tell us a little bit more about neuromodulators.
Right. So neuromodulators, right? It's this fancy kind of grouping for Botox and Dysport. And there's others, but these are the ones most commonly used. And I like to describe them as proteins that bind to the nerve and make them unable to fire. And these are great for areas of, facial expression. You can use it here, you can use it on the forehead, you can use it around the eyes, these different types of places. But essentially, it softens those areas of facial expression caused by a muscle or the muscle that's causing that wrinkle or that line. So the examples given here are smiling, frowning, talking, squinting. That's typically where these neuromodulators are used.
So I have a question for you. You ready?
Tell me. Yeah.
So I feel like in all of the TV shows and all of the movies, when someone's wanting to have a dramatic makeover, I feel like all of a sudden they can't move any part of their face when they get Botox done, and all of a sudden all of the liquid is falling out of their mouth, or their eyebrows all of a sudden are triangular. Tell me, is that something that I should look forward to if I do Botox?
No, so that's a great question. So, and that's kind of something that I get asked all of the time. Like patients will say, I don't want to look frozen. And you have to know something about the aesthetic here that we are trying to achieve. It's a very natural aesthetic. We don't want you to look overdone. We don't want you to not look like yourself. But with Botox, as well as with Dysport, it is dose dependent or unit dependent. And so there's a exact placement. And so if you want more of a softening, we can just soften it. If you want to be completely frozen, you can be completely frozen. I like to say how chatty or less chatty you want to look. And so if you want to be super chatty up here, we can leave you super chatty. But, if you want to kind of quiet it down, like I'll get school teachers saying like, I need my kids to know I'm mad. And so, we can leave you where you still have some expression there. But if you want to be frozen, I got your number.
I love that. Love that so much. So we talked a little bit already about this, but here are the more common neuromodulators that we offer. Um,
Yeah.
so I think,
So
go ahead.
yeah, so I just want to kind of go back because patients will ask me all the time, Botox versus Dysport. Like I've heard about Dysport, I've heard about Botox. There are some, there's some key differences as far as like how they're administered. But I like to say, if you like Botox, we have Botox. If you like Dysport, we have Dysport. It's really a patient preference. I like Granny Smith apples. You might like Gala apples. And so we offer them both.
I love that. I love that so much. I will
Yeah.
say that I don't play favorites. I'll take what you can give me.
Got it.
So here is an
I
example of the different areas, and I want you to talk a little bit more about these different areas where we could place this.
Okay, so I really love this slide because it goes over all of the little fun little places that we can use Botox because um, so many different, fun areas to use this in. Back when I first started injecting, over 15 years ago, traditionally we would think about Botox kind of like from the nose up and fillers from the nose down, but now they cross over so much. And, you can use Botox to help, lift the eyebrow. You can help Botox to soften the lines around the eyes. Obviously, you could use Botox or Dysport to help soften the area here between the eyebrows, the forehead. You can also use it for patients who squint around the nose, even a little bit here. If you have a really overly expressive smile and you show a lot of gum when you smile, you can use it to help soften how you smile. Some women will get a little texture on their chin with age. You can use, these neuromodulators there to help soften that dimpled chin appearance. Some women also with time, and I say women, but men also, sorry, Taylor, no prejudice there, can also will get a very square jaw. Some women like, their square jaw, but some patients will actually find that they are clenching in their jawline and it will grind their teeth. We'll also use Botox to kind of help soften the enlargement of this. The muscle here is called the masseter muscle. We'll use the neuromodulators here to soften that muscle, will help with the grinding of the teeth, but it also helps to soften the angle of the jaw and kind of gives a youthful appearance to it. Very pretty. I also like to use these along the upper lip line. And we'll go into this more when we talk about fillers, but if someone has lines along the upper lip where they're maybe considering doing a little bit of a filler, you can do a little bit of neuromodulator along the upper lid line and upper lip line, and it gives a little subtle fullness in addition to softening the lines you get with animation. Patients will say, I have never smoked a day in my life, but I have these smoker lines. You can place it there and it helps to soften those lines, but also gives a little fullness. And so you have an idea of what just a little bit of filler would look like without making that full leap. And so I obviously have, I love the use and placement of this because for some patients, a little bit does go a long way. And then some, want a lot to kind of really soften things. The other area I didn't talk about is the neck. With time, you can get a real obvious sort of banding appearance along the neck, and you can use Botox to soften these bands. It helps to kind of tighten or lift them back up so they're not as obvious. For some women, that's really what gives them away in the aging process. So lots of fun places you can use Botox.
I love hearing you talk about it because it honestly sounds like an artist with a canvas. The idea of all of these different areas that you can use it and how it almost is kind of like playing where you're able to figure out where best to add flourishes and to do these little things that make a huge difference. I could listen to it all day, but that's so amazing to hear. So let's look at a few photos that kind of represent what you were talking about.
Great. So here's obviously like the forehead, this area between the eyebrows is called the glabella. Here's some views so you can see this patient super chatty. So this brings up a good point in looking at this before and after photos. Sometimes, patients will say, I just want to treat the forehead. I don't want to treat the area in between the eyebrows. I always strongly recommend that you treat both areas because the two areas actually work in coordination with each other. And if you only treat one area, then sometimes another area will overcompensate. So you always, in this particular area, you want to treat both areas so that one doesn't overcompensate for the other. But it's kind of a dual treatment area when you're treating the forehead. You're treating the forehead as well as this area here. But you can see this patient had some really grooved in lines. And when she came back in, you can see how much softer they are just by treating that muscle.
Yeah, I feel like she almost aged backwards, which is crazy.
Yeah, it's great. I love this next one. Obviously, a little bit younger patient, but super obvious again, quieted her little bitty glabella muscle, much softer, much youthful appearance.
I love it. And she doesn't look as angry.
Yeah, yeah. Okay, this patient, great example. Still has, maybe first time with Botox or Dysport, 2 weeks later, softened up quite a bit. I would expect with repeated treatments of her preferred neuromodulator, those lines are going to get softer still, because you have to appreciate it's like any muscle you don't use, you lose. And over time, that muscle weakens. And over time, the lines will diminish and just get quieter and quieter. And so patients will ask me, well, we know that the results last, anywhere from say 3 to 4 months, right? And so if you don't come back in the desired time when the muscle starts to wake back up to repeat the treatment, the lines are going to come back. So you lose any benefit that you've gained. So it's really important that you come back in for that repeat treatment to keep the muscle quiet so that you maintain that added benefit. Otherwise, the muscle will regain strength and then you're right back to square one.
That's a great point to make. Definitely important to be consistent in your treatment and make sure that you are kind of working together with your provider to ensure that you're seeing the results. And a little birdie tells me that maybe potentially if you are still noticing those small lines even after repeated treatments, that there are other things that we can do. So just a little foreshadowing. So what we're going to talk about.
Yeah. All right, and then here's those nasty bands I was telling you about that for some women really gives away their age. I love treating these bands. Patients come back and they are so pleased with the improvement. It's one of those things that you treat it and it's just the result is it's really gratifying. And it just softens it and it softens the neck and it just gives a youthful appearance. Because our grandmothers have these bands, we should not have these bands. So yeah.
Well, it's awesome that there's something that's so minimal and so simple that you're able to do to make such a big impact. That's awesome.
Yeah. And then here's, the chin effect. This can appear at any age, but again, it tends to also show up as we get older. Little Botox in the chin. It's just really less, I would say, 6 units. Really softens up the chin. Looks super, super pretty.
Yeah, the after result is fantastic.
Yeah.
So we talked a little bit about neuromodulators, and we've hinted a few times about filler in our discussion, kind of where neuromodulators can be placed and some of the results that you might expect. So without further ado, tell us a little bit more about fillers.
So, fillers are traditional. I'm not going to say all of them, but most of them are made of hyaluronic acid. And hyaluronic acid is naturally occurring between your joint spaces. And so what I like to say, it's kind of what gives your joints their fluidity. It's also found in your skin. And so we use it to mimic those fat pads that have shrunk or shifted. Some will argue that we're using it to help lift, restore. But essentially, you can use it anywhere there is a volume loss. So you can use it in the cheeks, you can use it in the lips, you can use it in the smile lines, you can use it to help reshape a jaw. Sometimes as we age, I mentioned before that when you lose bone mass, elsewhere in your body, you're also losing it in the face and you'll lose it in your jawline. We can use it to help restore that volume in the chin. You can use it to help replace volume there. There's several different ones that we use. Again, hyaluronic acid, and patients will ask me, well, how do you know which one? Because there's so many different ones. And it's all about their cross-linking. And cross-linking has to do with their structure. And the way I like to describe it is think about different types of fences. So if you think about like a privacy fence, or you think about a chain link fence, or you think about a picket fence, or you think about, a barbed wire fence. So imagine the pattern or the structure of these different fences. It determines their use or the placement. Same thing with fillers, which is exactly why you can't use a cheek filler necessarily in a lip. You wouldn't want to use, in the area, where you might use a privacy fence, you wouldn't want to use a chain link fence. And so that's kind of how I like to describe the different types of fillers and why you would use one filler in one place versus another. And that's why the technology is important as far as knowing which filler is placed where, and why it's important to go to an injector who has experience and skill of their placement.
You hit the nail on the head. I was literally about to say that. It's so important to find someone that you trust and someone that you know is an expert in hyaluronic acid fillers to ensure that they're selecting the correct product for the correct place, because you want to make sure you're not overfilling somewhere like your lips, or underfilling in your cheeks and basically wasting your treatment. So super important point to make.
Yeah.
Then we're talking about the filler. Here we go. Your favorite. You love these.
Yes, I love these. I love these slides. Um, Again, such a great, slide to sort of point out, the different areas and places that you can use fillers. And so again, beginning with, the whole point and reason and placement for these fillers are because we're losing volume, fat pads are shifting and shrinking. And so the areas that we particularly notice is that under the eye, there's a volume loss there. Patients are noticing that there's volume loss here. Our cheeks are becoming flat instead of having a nice oval sort of shape, which is, if you think back to the original picture of the daughter compared to the mother, they drew kind of a triangle on the daughter's face, and the daughter had kind of this nice oval face. Well, with time, as these fat pads shift, our face becomes more square. This helps to restore that volume. And some patients, after, filling or doing a filler placement, will say, oh, there's my cheek again, or oh, I see my cheekbone again. I knew it was still there, right? It's just a matter of restoring and lifting things back to where they once were. It's not a matter of changing someone or making them unrecognizable. It's just restoring things back. Same things with like lips. Do I love doing like a very luscious lip? Of course, anyone who does filler does. But I also love restoring someone's lips, because with time, our lips look crepey, they lose volume, they get texture, they look deflated. Think about like a really pretty grape and then going to a raisin. You put a little filler in a lip and it goes from that like kind of raisiny look to sort of like a filled grape look. And so you can use, lip filler there. You can also use lip filler at the corner of the mouth. You can use it down here kind of on the smile ends, and you can also use it to kind of soften the chin. Lots of different uses for filler on the face. Again, it's knowing which filler to use, where to place it, so that you don't get unwanted swelling or unwanted desired side effects, or wasting your money. Wrong filler, wrong place, wasted money.
Yeah, definitely. And to go back to someone talking about the lip and such an impact, I know someone that had been treated and they had such a slim upper lip, and it wasn't like they were going for a like beauty guru lip that was just overdone. It was just the ability to kind of make it a little more pronounced and defined. And and I remember when she had it done, then she put lipstick on. She goes, I can wear lipstick now. And it still gives me goosebumps to this day, to that little itty bitty thing that happened that took less than 5 minutes or to do, made such a huge impact on her life. And it was so little. It was such a cool moment to experience.
Yeah, no, I'm grateful that I get to do these things.
Yes.
So this is a great before and after. I love this before and after. And it shows different areas where filler was used to help restore lost volume in this lovely lady. You can see that, if you kind of begin and look kind of from top to bottom, you can see under her eyes, it softened. There was filler that was placed in the mid cheek, which sometimes a little bit of filler in the mid cheek can actually lift the cheek. And as a result of lifting the cheek, that actually softens the eye. This lady had some in her mid cheek as well as in her cheek here, but also had some filler under her eye, which helped to kind of touch off or excuse me, finish off the tear trough area. She also had some filler here in her chin, as well as filler here, on her lower face, and here in her smile lines. I mean, it's a beautiful aesthetic. I mean, bravo to my colleague who this before and after belongs to. But this just goes to show you that you don't have to look unrecognizable after properly placed filler. It's
You could
beautiful.
just look well rested, and I love that.
Yeah, she looks well
She
rested.
had
Yeah.
such a great amount of sleep that I'm jealous.
Yeah. This pretty lady, she has filler in her mid face. And the thing that I noticed most about this before and after is how it actually thins her face, because by bringing the attention back to the mid face, because you can see she's actually hollow under her eyes. So you can see attention is brought back to the mid face, softening her in through here. To me, it sort of slims her face, if that makes sense, and gives her more of a youthful, rested appearance.
100.
Lovely result.
Definitely
Lovely result.
thinner.
Yeah.
And
Yeah.
more youthful.
Yeah. Go back one more time to that before and after. You can also see, and these are sort of subtle things that you should notice, right? So you can see it's placed in the mid cheek. Notice how she's softer under her eyes, but also notice how her smile line is softer as a result. So there's not filler placed under her eye and there's not filler placed to her smile line. It's just placed to the cheek. But because you're mimicking that fat pad loss, it softens the under eye and it softens the smile line as a result. Again, it's knowing properly placed filler, because sometimes what happens if you just place filler here and you're not correcting what's going on upstream, then it's basically you lose it. You really have to correct what's going on upstream before you work on. And sometimes just correcting what's up here takes care of these other areas. And this is a great example. So in this case, correcting the mid cheeks corrects the tear trough and the smile line.
That's awesome.
Yeah. This pretty lady, so much going on here and super exciting to talk about. So she had Botox. So this is, sorry, I'm getting excited. There's a lot to talk about. It's a beautiful aesthetic. So she had Botox, here at the corners of her mouth. And so you can see it's helped to kind of lift it. She also had Botox to the enlarged masseter muscle. You can notice in the filler placement, she had it in the mid cheek as well as the high cheek. And so look at the light reflex. Do you notice in the before versus the after photo where the light reflex has changed? So it's obvious her cheek is lifted, right? The volume has been restored where it properly should be. The other thing is you can see her smile line is softer. The corner of the mouth is softer. And then she's also had some volume in her chin as well as her jawline. Again, beautiful placement of the filler. And it's just, these are subtleties, correct? So it's not, she doesn't look overdone. She doesn't look unrecognizable. She looks like a restored version. I mean, she looks like herself. She just looks years younger. She also has some, I believe she also, I don't think she had, they're not commenting about having any filler in her lips. They talk about maybe a little bit of Botox in her lips, but definitely a softening of the lip. Very pretty. And that could be done, that refers back to the Botox I was talking about, how sometimes just a little Botox in the lip can give you a little lip flip. That could be all that was done, and that gave her a little fullness to the lip.
It is so interesting to look at this photo because it really does look like a younger version of her. I feel like you could almost make a case that it looks like her daughter. Such a beautiful response. Yeah, you definitely can see the structure that is kind of rebuilt there, and it's beautiful.
And then this patient, this is a comment that I hear a lot, is I've lost my jawline. And so this is how we can use filler to basically restore the jawline, help to bring back the angle of the jawline. The point of this before and after is really to kind of point out the jawline. You can also tell she's had some in the cheek because it's helping. You can tell the light reflex is different on the cheek, but Again, beautiful aesthetic, beautiful restoration of her jawline. It just takes years off. And again, she looks like herself. She doesn't look as though she has been changed or modified.
100%.
This gentleman, this one's for the guys, Taylor. This gentleman has had some filler under his eyes. Again, you can soften the tear troughs by lifting the mid cheek, and then also placement directly in the tear trough. Again, beautiful aesthetic. And again, it's knowing what fillers and the property of what filler goes where, to make sure that you have a good outcome.
Love it. Love that he's there representing the guys. We like it too.
All right, this is my favorite little example here of a very natural lip, not overdone, super subtle. I don't think anyone would look at her and think that she's had her lips done. They just look lovely. But if you look in the before photo, you can see that there's some volume loss. They look, I mean, she doesn't have I gave the reference of a grape versus a raisin. I wouldn't say her lips were a total raisin, but you can see that there's some volume loss. They look dry. They look not as hydrated as they are in the after photo. But again, very natural aesthetic. So not to fear that you would be overdone if you had a lip filler. Here's kind of a forward face of that same patient, her before photo, as well as the after. Again, not overdone, very subtle correction. She had one full syringe in her lips. And some patients sometimes will say, I don't know that I want a full syringe. This is a great example of one full syringe. It's definitely not overdone. Very beautiful correction. The side profile, it shows you just a little fullness. Again, lovely. Same kind of idea. This is, again, showing you the hydration factor, that fillers can make lips appear more hydrated, more youthful. Lovely. I love the outline of the border of her lip.
So we talked a little bit about HA fillers, and I think that those results really speak for themselves. And it's so interesting to hear about how the placement can really kind of set the tone and kind of rewind the clock sometimes, or maybe give you a few extra hours of sleep. So I know, and which we all want. So let's talk a little bit about something that I kind of know is one of your favorites, is talking about biostimulators.
Yeah, so I am super excited about these. This is something that I talk about a lot, I use a lot. Sculptra is my friend, and I use a lot of Sculptra, especially in patients with thin. And I think this is a great before and after example. The reason I like to use Sculptra is because, number one, it just has such a natural appearance. And in some women, we may then follow up with a traditional hyaluronic acid filler. And that's kind of what we were referring to in the previous slides and in the previous correction. But Sculptra is great for patients, men or women, who have significant all over volume loss. And sometimes it happens as we get older. It's not so much that it's not so much that we look and we're like, my smile lines are my this. It's just that we just feel that we look drawn. The thinness in our face is making us look older than we actually are or even feel. And Sculptra is a great way to help stimulate your own collagen and restore lost volume over the entire face. Sculptra is placed differently. So whereas the hyaluronic acid fillers, kind of what we were showing before, those are instant gratification. You come into the office, you have your hyaluronic acid fillers placed. Sometimes we may do it in sessions, and that, if you require multiple syringes, we may do the traditional hyaluronic acid fillers, in one setting, or you may split it up over two settings. But Sculptra, you have to be more patient with, and that we're doing a vial or two. You come back in 6 to 8 weeks later, and you're waiting for your body to stimulate its own collagen. So I like to say that Sculptra is laying seeds of collagen stimulation. And so when you look at this before and after photo, so the before photos are to the far, far left, the after photos to the far right. Specifically, it's something that just when you take a quick glance, you notice in the before photos as compared to the after photos, she just looks less gaunt. She just looks less overall thin, less overall tired. But then when you start to look and notice at specific subtleties, look under her eyes, look around her mouth, look down here around her kind of smile line chin area. She looks less hollow. It just has this overall volumizing effect to help restore that youthful, less tired appearance. And you can use it in, women who aren't thin. I don't mean to say you can't use it, it's specifically for thin women, but I like this for, men and women who have a lot of volume loss because it helps to stimulate, collagen. Some will actually argue that in any woman who is postmenopausal, where you're really getting a lot of that bony loss, this is the one that you start with because you can help to sort of, you're not going to grow bone. That's not what I'm saying, but it can really help to kind of mimic and replace and restore the loss that's occurred so that it kind of brings you back to that youthful face appearance. Yeah, I really love Sculptra.
I love that. And I also love the fact that I feel like, as you said, it's very much in the subtleties, but it's kind of like you look and she looks very natural and you know that something has taken place, but you can't tell what it is. But she just generally looks more youthful.
Yeah, no, I have had patients come back and tell me that after having had Sculptra, that patients will ask, did you have a facelift? Did you have this? They can't tell. But it's definitely a youthful sort of appearance. Yeah. I also really love this before and after. Again, if you look in the before photos, the far left, and then you compare to the far right, look specifically in the lower face as well as in the temples, because some women, and this is probably why I like it so much, is because I use Sculptra myself. I use the other HA fillers too, but I get really hollow in my temples. And that's what I find really ages some women, is they get really hollow in their temples. I like Sculptra for that area. You can use it all over the rest of the face, but again, Sculptra helps to stimulate collagen, replaces that volume loss. But you can compare her temples in the first photo to the after photo, and look down here, kind of in her smile line area. She makes a cute little expression where she's kind of holding her expression, and she's just less gaunt. She just looks more youthful in the after photos as compared to the before photos. She looks more youthful in the mid cheek. I talked about the temples, but you can really see it in the lower face. She just looks less hollow.
Yes.
So,
it's such
and
a beautiful book.
some will even argue that you can start with Sculptra, and once you kind of like build and get to the degree of collagen stimulation or the build that you want, then you can go back and touch it up and do refinement with the traditional hyaluronic acid fillers. And I do this all the time.
I love that. Another reason why it's super important to schedule a consultation so you can kind of figure out what your action plan is to meet your specific needs, for sure.
Yeah. Okay, here's another one of my favorites, is using Radiesse, which Radiesse, I'm probably not giving enough credit to Radiesse for the being used on the face. You can use Radiesse on the face, and so but my favorite is really using it in these body areas in a hyper dilute way to stimulate elastin and collagen. You can use it in the neck, you can use it in the chest, you can use it in the knees, in those areas where you have lost elastin and collagen. And it helps with that crepey skin, that skin where it looks loose and it's lost that tone. And when it's administered in a hyperdilute way, it really helps to tighten the skin. So in this before and after, you can see kind of the neck area as well as in the chest in the before and the after with the Radiesse administered. The neck just looks tighter. So it does the chest area. I love hyperdilute Radiesse. People ask all the time about like neck and chest areas. This is my go-to. And I'll refer back to it later. I also like to combine it with microneedling and ultherapy, because when you pre-treat with these things, you just get an even greater collagen and elastin stimulation.
I love that. These before and afters are fantastic.
Yeah.
So let's talk, oops, getting ahead of ourselves. Let's talk a little bit more about, so we talked like about dynamic wrinkles, motion. We've talked a little bit about volume loss. Now let's talk about tone and texture, kind of those more fine details.
Right. So, this is a great point. So to me, this is like the fine brush on the canvas, because patients will ask me about, treating volume loss, but then, we get all the volume restored. And then, there's a discussion about, whether or not, the tone and texture and treating this. And this also contributes to, an aging appearance. And if you're not treating the sun damage, and if you're not treating the little broken capillaries, this can also, contribute to, an aged look. Um, Sun damage, obviously, you spend too much out in the sun, time in the sun, it can cause brown spots, it can cause broken blood vessels. It changes the texture in our skin. Obviously, we're a dermatology practice. We talk a lot about pre-cancers that can show up as a result of too much sun and skin cancer, right? So, yeah, too much sun can lead to some real harsh realities.
For sure.
Scarring. Yeah, scarring, right? So scarring can not only be, secondary from acne scarring, but also surgical scars. There can also be, scars from treating those skin cancers. And then even too, if you've had, skin conditions, such, they use chicken pox as an example, but cuts, wounds, things like that. There's so much that can be done for scarring. And sometimes as these scars age, the older we get, they can also change in appearance, and that can also contribute to an aging appearance.
For sure. So now that we've talked about tone and texture, we're going to start talking about the goodies that we've been waiting for. We want to figure out what we can do about them. How can we fix it?
Yeah. So microneedling. I love me some microneedling. I have done microneedling. I'm a microneedling candidate. It is not a one-time procedure, but microneedling works on the principle of something our body does naturally. It basically takes advantage of wound repair. And so what happens is, as microneedling, as these little fine needles pass over, it causes this micro tissue damage. The healthy skin goes into wound repair mode to stimulate collagen. We have skin pin, which is your traditional microneedling, which I love for acne scarring. And there's also microneedling with radio frequency. And radio frequency is a form of energy, which, when combined with microneedling, helps to tighten the skin. And so it just feels, it's a fancy form of heat. But essentially, microneedling, when done as a series, you do it once a month, over a period of 3 treatments. It can improve acne scarring. It can improve those deep set in lines. So we were talking earlier, you do Botox, but yet you still have this really grooved in line. Follow up with microneedling. Microneedling you can use to really kind of stamp out those grooved in lines and stimulate collagen. You can do it as a series and repeat it again. We continue to age, and so you want to kind of, consider doing it in the future, but there's a definite prolonged collagen stimulation that you get with these things.
That's amazing. And I know that there's also something called liquid gold that we can add to this.
Oh, yes. Thank you for reminding me about that. That is my favorite. So there's 2 things that you can do with microneedling. So number one, some patients will do PRP, which is protein-rich plasma. And so I've heard it called the vampire facial. We call it protein-rich plasma. You'll see that written about in the literature. But protein-rich plasma is, we draw your blood, we spin it down, and we take off that protein-rich plasma and we infuse it into the skin as we're doing the microneedling. I also recommend using something called biopel tensage as part of your aftercare when you do microneedling. There is a stark night and day difference when you use this biopel tensage, which is this growth factor that really helps to kind of amp up that collagen stimulation as you're healing. I've had patients do microneedling elsewhere and then do microneedling using biopel tensage afterwards, the 40, night and day difference. So shout out to biopel when you do it after microneedling. I love microneedling in general, but if you're going to do it with a biopel. Yeah. So do the PRP as part of the procedure, but in your aftercare, use the BioPel.
Always looking for a great way to amplify those results. That's so fantastic. So
Yeah.
we talked about microneedling. Let's talk a little bit about laser resurfacing. Let's take it to the next level.
Yeah, so laser resurfacing. So we have the micro laser peel, and then patients will say, "I'm, kind of overwhelmed. Do I do laser resurfacing? Do I do micro needling? Where do I start? Like, which one do I pick?" And really and truthfully, a lot of times it's all about the downtime. So micro needling is nice because the downtime can be short, and that the recovery time can be minimal, 3 to 5 days, 5 to 7 days max. I say 5 to 7 days, that's really extreme. Most people, it's like that 2 to 5 day kind of window. Whereas true laser resurfacing, you're looking at like anywhere from 7 to 10 days kind of downtime. And so, laser resurfacing, again, it's sort of maximizing that, impact to sort of treat what, it can treat both scarring and texture, fine lines, wrinkles, but it's all about the downtime and what you want to pick your procedure. If you have time to allow, 7 to 10 days to recover, do the micro laser peel. You'll get the biggest bang for your downtime and the procedure. But if you want to space it out, space your downtime out, do the micro needling. And they both can, get you to your desired goal.
I love that. I love that there's different options, and I love that it's kind of like, well, you could you could do it quickly and get it over with, and there might be a little bit more of a downtime with it, or we can do kind of the more long-term approach. It's almost in a way, and you'll probably tell me no, but it's probably kind of like how your sculpture versus your filler. It's more of your instant result versus your long-term result.
Yeah, absolutely. Absolutely.
And then another fun thing, love these. This is one of the coolest before and afters that we have. I love these.
Yeah. So I love a photo facial too. And patients come back every year after summer. And I like to say, if you've had too much sun, we should meet. But it's always like there in October, everybody shows up for their photo facials because, it's not a permanent result. We live in Texas. You're going to get sun exposure. There's some skincare we can talk about to help prevent, the recurrence of it. But photo facials help to clean up our summer fun, our Texas sun fun. But photo facials, depending on, they can adjust the settings, but can target the browns that we get from sun damage, as well as the little broken capillaries. And basically, as the photo facial passes over, it targets those little broken blood vessels, targets the little brown spots. The browns will look like, and initially look a little darker. The reds may look like kind of like, I like to say, little cat scratches. But over a period of like 7 to 10 days, they kind of slough up, flake up and peel off.
Love that. And we're going to see these pictures now. I'm so excited.
Yeah. Yeah. Oh yeah, no, these are great. And this is a great way to sort of, anticipate day of, more red, more pronounced. Day 3, that's exactly right. They look more brown, more pronounced. Day 7, it's all kind of flaked up and peeled off. And going back to, this is kind of reminding me the downtime for, and what you're going to look like after the microneedling and the micro laser peel. Essentially, you just look like you've had a really bad sunburn. And it's more of a sunburn with the micro laser peel, less of a sunburn with the microneedling. And again, the downtime is kind of look like what I was saying, more downtime with the micro laser peel, the laser resurfacing, less with the micro needling. But the IPL is great. Lots of people will go right back to work. Like no one feels like they have to hide after an IPL.
And these results, man, love them.
Oh yeah, look at that chest. That is fantabulous. Lots of flaking and peeling. Like she looks like she hit all summer. Like she was a good girl with her sunscreen.
Yeah. And she's getting back. We love it. We love it so much.
Yeah.
So let's talk briefly about some chemical peels. So tell me about chemical peels and how they kind of fit in the spectrum of treating these conditions.
Yeah, so chemical peels are a great option for maybe somebody who really just has pigment. So a photofacial can also help with reds. So we talked about broken blood vessels. Chemical peels are great for maybe if you have melasma, which is the pigment that you can get from heat as well as, sun, but it's also hormonally driven. And sometimes it can be aggravated by lasers. And so chemical peels are a great niche for that patient who has found that they have true sort of melasma. Chemical peels are also great for people who have acne and want to kind of clean up some of that pigment as well as their acne. And so I like chemical peels because if you want to peel for 2 or 3 days, or if you want to peel for 9 to 10 days and you want to peel for like a snake, there's an option for you. It's really just discussing it with your esthetician on how much you want to peel. And so some patients are like, I don't know about a peel. I'm really afraid. It's really just a conversation you have to have with your esthetician. If you want light flaking, we have a peel for you. If you want aggressive peeling, like some patients don't feel like they've gotten their money's worth if they don't peel like a snake, we have that peel for you.
I love that. I love when you can choose your own adventure and when the outcome is great.
Yeah, yeah.
And then I think our final thing here is we're talking about some skincare. So lay the goods
Yes.
on.
Skincare, you just can't do this fun stuff if you're not using good skincare, right? And obviously sunscreen is number one, right? You want to make sure that you're on an SPF of 30 or greater. You're applying it daily. I personally am a vitamin C girl. I will say your next thing that you want to be is a topical vitamin C. And I'm totally a vitamin C snob in that I recommend SkinCeuticals vitamin C. The founder of SkinCeuticals discovered the benefits of topical vitamin C, and there's 3 different ones. And that's my second recommendation. On the flip side, my next recommendation would be like a retinol or a retin-A. Use that at night. And there's, so many good options to choose from on retinols, prescription or professional grade. And then there's lots of other little things that you can use in between. So, here at the Steiner Ranch office, we have something called custom dose, where we can take the raw ingredients of tranexamic acid and kojic acid and niacinamide and some hydrovance, and we can formulate it specific to your skin type. And I can even throw in a little retinol in it. And so it's a great tool for someone who wants kind of an all-in-one topical. But if you're not using good skincare, you're not going to prolong the life of your procedures. And so you really want to be on good skincare. But like I said, if I only got to pick one, it would be sunscreen. If I got to pick 2, it's vitamin C. Pick 3, I'll go for the retinol, and then lots of fun stuff that we can kind of intercommingle. But it's all about an individualized conversation, and that's where I get super excited. And obviously, I could go on for days about skincare. Yeah, I love talking about it.
You beat me to it. Consultation. So this is super important. One of the best things about this entire experience is that you can have like your own custom experience of this, and you get to have all this time to chat with a lovely PA Jordan, and she can tell you about all the things that she can help do for you, that little artist that she is. And she also, along with our other dermatologists, are able to help you with medical things as well. So don't think that we can't help you with your skin cancer or your acne or those other things. But what's great is you can kind of partner a lot of these things together, pre or post conditions to kind of get your skin to where you want it to be. So I cannot harp enough on meeting with a skincare professional or dermatologist to curate something that's meant specifically for you and helps you meet your needs. Something that I think the over-the-counter things can sometimes miss. But I just want to thank you so much for joining us today. It's been so much fun talking about this. I know that you love it as much as I do.
Yeah.